How does competitive bidding affect Medicare DME coverage? Imagine a system where the prices for medical equipment are decided through a bidding process. This is what happens with Medicare durable medical equipment coverage in certain areas. When the government runs a competitive bidding program, suppliers submit bids to provide specific equipment like wheelchairs, oxygen equipment, or hospital beds. Medicare then looks at these bids and sets a single payment amount based on the lowest or most competitive bids. This replaces the previous fee schedule prices, which were often higher. The goal is to make sure the prices reflected what's fair in the current market and to help save money for Medicare and taxpayers. In areas where the program is active, only suppliers who win the bidding process can provide equipment to Medicare beneficiaries. These suppliers sign contracts and agree to offer all the equipment included in their contract. If you live in a designated bidding area and have original Medicare, you will need to get your DME from these approved suppliers for Medicare to cover the costs. This means that if you go to a supplier who is not part of the program, Medicare might not pay for your equipment. The process also helps prevent fraud and waste by making sure suppliers are accountable and offer quality equipment. Because the prices are set through competitive bids, Medicare can control costs better. The program currently applies to specific items like off-the-shelf back and knee braces in certain areas. It does not directly affect Medicare Advantage plans, but those plans may notify members if supplier options change. In the future, the program is expected to expand to include more items like continuous glucose monitors, insulin pumps, and other medical supplies. This expansion aims to keep costs down while making sure people still get the equipment they need. Sometimes, there are gaps between bidding periods, but the Centers for Medicare and Medicaid Services plans to run new bidding rounds to keep the system running smoothly. Overall, competitive bidding influences Medicare DME coverage by setting fair prices based on supplier bids, limiting coverage to approved suppliers in specific areas, and promoting cost savings. It also helps ensure that beneficiaries receive equipment from trusted providers. This process balances saving money with making sure you get the quality equipment you need to stay healthy.